Good afternoon, everyone, and welcome to the Shelby County Joint Task Force update. I hope that everyone had an enjoyable and healthy Thanksgiving holiday. I'm going to give data updates as we typically do, and then Dr. Randolph's going to join me and give some additional updates, and then we'll open it up for questions. We are in the middle of the fall surge. We predicted some weeks back that we saw a foreshadowing of a very challenging fall, and we are in the middle of that. We appreciate all the efforts that this community has taken to reduce the transmission of COVID-19. However, we do know that we will have some challenging weeks ahead. We'll continue to give updates on Tuesdays and Thursdays. Our goal is to continue to do everything that we can to reduce transmission so that we avoid additional restrictions across our community. As of this morning, we have 48,714 cases. That's 609 new cases in the past 24 hours. And we know at the current time we've experienced 672 deaths. We still continue to have a mortality rate of about 1.4%. We have typically had a death rate of 1.4 to 1.5%. Again, that is much better than the rest of the country, and that is a testament to the healthcare systems that we have locally and the ability to provide care to those who need care. What is important at the current time, we know that we have 3,730 active cases. So that means today there are almost 3,800 people in our community who have active COVID disease. Those are the individuals we know about, but there may be others who are asymptomatic, which then increases that number significantly. We continue to look at the ages of those who are infected with COVID and how that impacts our local pandemic. And what we know is that the majority of individuals continue to be under 34 years of age, but the highest group with infection are those from 25 to 34. And so while our messages really are to the full community, we want those who are most at risk to really heed the information that we provide. In addition to that high group of 25 to 34, 35 to 44 is the next at-risk group. Those are individuals that are more likely to be in the workplace, more likely to be engaged in social activities, as well as more likely to be potentially going to school. We started in mid-September gathering additional information from cases that would allow us to better tailor any interventions that we have to take locally. So I wanted to share some information that we compiled recently that was for the month of November for 303 case interviews that were completed. We do know that about 49% of those individuals continued to engage in activities of daily living while they were infectious. And the types of activities that they engaged in were, one, they continued to go to work. So 76% continued to go to work while they were infectious. And for this number, they may or may not have been symptomatic, but our previous data indicated that about 4 out of 5 people do have symptoms locally. We know that almost 40% continue to engage in social or public activities. That could be things like shopping, going to a restaurant, visiting with friends, and so on. And then a much smaller percent, 3%, continue to engage in school-related activities. What was very important to us, and has been a continued theme as we look at this particular data, that people continue to go into the workplace when they are infectious and pose a risk to others. And again, many of those people are symptomatic, a smaller number are asymptomatic. So we know that 45% worked at least one day, but if we looked all the way to 2 or 3 days, well over 80% of people continue to work while they are infectious and pose a risk to others. So I want to reinforce the importance of picking up very subtle symptoms. We know that, again, some people don't have symptoms, but many people have very mild symptoms. Could be a runny nose, a slight cough, a headache, muscle aches and pains, being tired, some GI problems, stomach upset, and perhaps diarrhea. Others will have loss of taste and smell. If you experience any of those symptoms, please do not go to work, do not go into public places, get tested, and await those test results and then take action accordingly. We also want to report out on the indicators relative to the tripwires. I do want to remind everyone that the purpose of the tripwires is to allow us to take action in a more timely manner. Some of us have begun to use the words guardrails. They're not an absolute black or white. They're in context of the gating criteria we've talked about all along. And so they're important, but they're not the only data that allow us to make a decision. So we have talked about the importance of taking urgent action if our cases are greater than 450. Over the last 7 days, we've averaged 361 new cases per day. That is actually a slight decrease from what we were experiencing several weeks ago when we issued Health Directive number 15. For a 14-day average, we're running about 379 new cases per day. So again, that's less than the over 400 that we had previously, but it's still much higher than the 200 to 220 that we were running for a significant portion of the end of the summer. Our reproductive rate currently is right about 1. That is a slight improvement. We want to continue to watch that, but we want to get it to much lower than 1. And our test positivity rate, unfortunately, is running above 10%. And we always want that less than 10%, but ideally less than 5%. So I'm going to end with the data report there and just reinforce a few things that are important as we go into the fall and particularly as we experience this surge. In addition to an ongoing focus on case finding, which is early detection of individuals who have COVID by identifying symptoms and getting tested, or those who engage in assurance testing, we will continue to focus on public health capacity and our ability to be able to get people isolated and quarantined quickly. That's done in partnership with many employers and organizations, not limited to the health department. We're still preparing for the surge, but one of the things that we're focused on currently is what efforts can be put in place to assure that hospitals have sufficient staffing as they have more patients admitted, not just with COVID, but flu, stroke, heart attack, and other things. And there are some efforts underway to really focus on recruiting staffing, not only through the Medical Reserve Corps, but also through alternate methods as well. But we're also now focusing very heavily on vaccine receipt, so receiving the vaccine here in Shelby County and assuring that we're able to get that to the field and get people vaccinated in a very timely manner. So more to come, particularly on the surge and our ability to provide vaccine. Lastly, I just want to remind everyone that collectively the Joint Task Force, which includes the Health Department and others, we strive to get communication out to be able to provide information to the public and others who need it. The main ways that people can access that is by paying attention to the press conferences, listening in on the press conferences on Tuesdays and Thursdays, but also there are regular report outs to the county commission through the health committee as well as the full commission, and then also to visit our website at shelby.community. So I'll end there and turn it over to Dr. Randolph. Thank you.
Thank you, Dr. Haushalter. Greetings, fellow citizens of Shelby County. I'm Dr. Bruce Randolph, the Health Officer of Shelby County Health Department. Just a few things I want to address, and primarily address the elephant in the room, and that is there have been a lot of reports and concern about the activity that took place over the Thanksgiving holiday weekend, parties at different locations, but one in particular. But one thing I want to first remind all of us, and that is that we all have a role to play in preventing and controlling the transmission of this virus. And as I've said before, I will repeat again, just because something is legally permissible is not medically advisable to attend or participate. Just because it's open, you should not go. From a service and business perspective, the health directive is very clear in what the safety measures are required. And we intend and will hold all services and businesses and individuals to the health measures outlined in the health directive. The current one is Health Directive number 15. I want to just tell you that we are currently investigating the situation and allegations that is in complaints. Again, not only of the particular establishment that has gotten a lot of publicity, but others as well, to make sure that everyone is adhering to our health directive, and we will take the appropriate action at the appropriate time. So please do not interpret our lack of immediate response to your particular timetable as an indication that we are not intending to do something. We will respond. But in the meanwhile, I want to just say to even the individuals, you must exercise judgment. For months, we have characterized this virus. We have repeated over and over, how is this virus transmitted? Things you can do to at least help prevent, it may not 100% prevent, but lower the risk of spreading the virus as well as getting infected. We've asked everyone to wear your mask, to maintain 6 feet separation, to avoid crowds and gatherings, to go get tested, especially if you at risk, you engage in activity that place you at risk, visit places that place you at risk, are you around loved ones who are more susceptible to the adverse effects if the virus infect them. So I'd ask you, fellow citizens, your behavior this weekend, was it the right thing to do? Was it the responsible thing to do? Was it the safe thing to do? You know, to go to an event, crowded, hanging out within 6 feet, yelling, singing, no mask, doing all the things that we've asked that you not do. And then knowing that you have at home a grandmother, a mother, a relative, a loved one who may be more susceptible, even if you're not susceptible. You have to ask yourself, why? Is it because you're tired, fatigued, you don't want the government to tell you what to do? Or is it that you don't care, or you're selfish? These are issues and questions you yourself must answer. But I'm asking that we all do our part, and we all adhere to the safety measures that we have in place. And no, we can't be everywhere at all times. You, as an individual, as a person, must exercise the responsibility and the discipline and the commitment to remain safe and do what you can do to remain safe, to protect yourself and to protect others. With that, I will stop and entertain, I'm sure, many questions that you may have.
Jacob Steimer, Memphis Business Journal.
Yeah, I guess as my first question, I'm hoping that Dr. Haushalter, you can contextualize for us just how bad these new hospitalization numbers are. Hitting 500.
Sure. So early on, probably about 2-3 weeks ago, we predicted we might have 500 in the hospital at Christmas. Now we have 500 at the beginning of December, which means that if we look several weeks out and we anticipate a surge, even if it's a small surge from Thanksgiving, we're going to have significant challenges in the hospital systems around the Christmas holiday. And the issue is not just the number of admissions or the number of hospital beds available. As has been noted, there are significant staffing shortages. There's a significant shortage of nurses across the country. We are not likely to be able to recruit people to come here to be able to assist us, so we're going to have to rely on our local resources to be able to staff those hospital beds. Critical care, intensive care beds really require specifically trained nurses and other healthcare professionals, and ideally you want those individuals to be experienced as well. So we are concerned about the numbers. I know the hospital systems are doing everything in their capacity to meet the needs of the patients that they serve, working very closely together to be able to learn from each other to, again, meet the needs of our community and other communities where we draw patients from. And that includes things like reducing or halting for a period of time elective surgeries, working closely with the Joint Task Force to provide updates, but also to work with us to help identify solutions for staffing. So we're doing all that we can locally, but it is a concern to us, which is one of the reasons we're focused heavily on reducing community transmission so that we can reduce the burden on the hospital systems. Your follow-up, please?
Yeah, well, I guess the follow-up is, with hospitalizations so high and elective surgeries already being delayed, why do we still have bars open? Why not try to do everything we can to make sure the hospitals don't get overrun?
That's a great question, and as everyone knows, we've received a lot of feedback and opposition to actually placing restrictions on restaurants. So I'm going to talk specifically to your comment about bars. During the early part of the pandemic, when we put restrictions on restaurants and limited service restaurants, over time, all of our local limited service restaurants actually are following the same guidance and regulations and requirements as a restaurant. So we no longer separate out a bar from a restaurant or a limited service restaurant from a restaurant. They're all treated as restaurants. What we have done in Health Directive 15 is to place restrictions on restaurants, clarify the importance of masking not only in the restaurants but also in gym facilities. We will continue to monitor that. As I've noted, our average of patients per day over a week is well over 350, but that's less than what it was several weeks ago. So we'll continue to monitor for stabilization and decreases. If we see trends upward, we will revisit our interventions and make changes accordingly.
Kendall Downing, WMC.
Good afternoon, everyone. My first question is about the party at Club in Love over the weekend. I know you mentioned the investigation that was ongoing. Could you talk about what you are looking for in that investigation, who you are investigating, any details you can share, and are there other events from the weekend that you all are looking into? And I have a follow-up. Thank you.
Yeah, good afternoon. I'll say a few comments and then ask Dr. Randolph if he wants to add to that. Some of the things that go into an investigation have to do with what is all the evidence and data that we have. So one of the things that has been very helpful to us at the health department is many people reach out to us with complaints. They can send them to us via email at Shelby TN Health, but they also can call us at 222-MASK. They can call the Mayor's Action Center. They can call any municipality. It's going to make it to us. However, what happens is when pictures are sent to us, they're really viewed as hearsay. So we have to have corroborating evidence from an eyewitness of the event. It does help, and it's a good takeaway. If someone does take photographs, it's important to make sure the date stamp is on there, and ideally some information about the location or the facility so that we can use that information. We can use some of it for education. So an example, we may get a picture of a fast food restaurant where the workers don't have the mask on properly. We're not going to close the fast food restaurant for that. We're going to go with the pictures and show them the importance of putting the mask on correctly. However, if you have a very large event that's likely going to result in a closure, it may result in other penalties, we have to have corroborating evidence. So we're making sure that we are interviewing everyone that we can that at any point had contact with that facility. That includes our inspectors. There's also some law enforcement officers that were there at a certain point, and making sure that we have sufficient evidence to support any actions and enforcement that we take. And I know you're going to have a follow-up, but I want to ask Dr. Randolph if you want to add anything.
The only thing I would add is that also part of our investigation is internal. And that is, we want to assess our success and failures, any shortcomings we may have had internally in terms of our investigation team that may have contributed in any kind of way to the event taking place in terms of the ball falling.
All right, thank you. And then my follow-up was about, before the Thanksgiving holiday, the Memphis Restaurant Association sent out a lengthy letter to the health department outlining some things. I was just wondering if you all could comment generally on that letter and the dialogue with the association moving forward. Thank you.
Thank you. That's a great question. We've had a lot of requests to comment on the letter. What I've said is that the Memphis Restaurant Association sent me, as well as some others, including Mayor Harris and our county attorney, a formal letter. It has a lot of information in there, as well as requests and comments. I will respond to that letter formally. So I've opted not to make specific public comment on the details of it, other than to say I will respond to that. I do want to say publicly and on the record, I had conversations with the Memphis Restaurant Association before we issued Health Directive number 15 on multiple occasions. That include phone calls as well as text messaging. And then, as you're likely aware, there's a transition of the leadership in the Restaurant Association. So I have an upcoming communication with the new incoming president on Thursday, along with Mayor Harris. There's a few others that'll join, including Mr. Meller, who's the immediate past president. I do want it also on the record that that conversation and planning for that conversation was being scheduled prior to and around the issuance of Health Directive number 15. So we do want to have ongoing communications with the Restaurant Association and be able to provide information that helps them better understand decisions that are made locally to reduce transmission. Once we respond formally to that, then I'll make more detailed comment on the letter specifically.
Dominique Dillon, Fox 13.
Hi, I just had one question in regards to Club in Love. I just want to know, did you guys issue a permit for their event on Saturday?
No.
Thank you.
Mm-hmm.
Jenny DePrizio, Local 24.
Yeah, I have going to follow on the club situation. Can you discuss the previous violations in Love? We know you had announced in September they had been, there were violations, and then also I had heard that in October. So can you discuss the previous violations at that club and the outcomes of those? Were they ever, what happened following those outcomes or violations?
So again, I'm going to make just a few brief comments and turn over to Dr. Randolph because he has more detail on that particular facility. I think the comments that I want to make is this pertains to all facilities. Our initial approach has always been to engage with the manager or owner, make sure they understand the health directive and all the requirements based on the health directive, whichever one is current at the time, and to provide education prior to moving towards enforcement. When we move towards enforcement, that means that there's likely been multiple infractions that we think are not being corrected adequately prior to the intervention that we seek at that time. So I do know that that facility has been closed once previously, but that was for a different type of violation. And then again, I'll turn it to Dr. Randolph for more detail because he's worked very closely with the owner of that facility.
Yes, so the facility that you mentioned in Love, Memphis, was closed earlier, but the violation was they were operating when at the time limited service restaurants were not permitted to operate. So the owner, Mr. Given, closed the restaurant and actually went through the process of getting a full service licensed restaurant. And therefore, once he did that, he was allowed to operate just like all other full service restaurants were allowed to operate. As Dr. Haushalter has mentioned earlier, now the requirements for full service restaurants are the same for limited service restaurants. And therefore, any limited service restaurant, if they meet the health safety guides in the health directive, are able to operate. And so that was the violation that was found in September. In October, he was inspected. November 17th, no violations were noted. He was subsequently allowed to reopen and has remained open and operational to this point up until the event that we talked about. I would even want to just comment that we even inspected the facility on the 28th, and at that time the inspectors at 3 o'clock, 3:46 to be exact, found no violations. So the violations that reported and alleged that we are currently investigating occurred after that initial investigation and seemed to have occurred somewhere around 8 o'clock or beyond. So that's all about that particular establishment that I know and can share.
If you're saying your inspectors were there, here's my follow-up, on the 28th at 3:46, did they not follow up when the event actually began, which started officially at 4 o'clock, or were they there prior to the event opening, and did they keep an eye on it at all?
Well, they returned at 8 o'clock, and according to the report, and these are some of the investigations we're still doing to get further clarity, is that they inspected and noted that there were some without mask, social distancing was not being adhered to, but this was occurring in a tent outside. There was some confusion about whether a tent is considered indoors, outdoors, and at that particular time, there wasn't a decision to close the facility at that time.
Katie Reardon, WKNO.
Hey there. Yeah, Dr. Haushalter, I'm hoping you can speak a bit more specifically. You talked about some solutions that you all are exploring for staffing, and I'm wondering if you can tell us a bit more about those, given what you said, that it's going to have to rely pretty exclusively on local resources.
So a couple things. Let me first say actually where we're going to need staffing. So we do anticipate getting vaccine here in the middle of the month. So in addition to a need for hospital staffing, we actually need staffing that's going to assist with vaccine administration. The vaccine that's coming, the Pfizer vaccine, is a very tenuous vaccine, and so we need to make sure that once it's received, we're able to get it to the field quickly and administered quickly. So we actually need it for both. And some of the things that we're looking at specifically for vaccine administration is how do we partner with any person or organization that has personnel that are licensed to administer injections. So in addition to nurses, RNs, and LPNs, pharmacists now can also give injections, EMTs, paramedics can give injections. So we're doing a call for volunteers from some of those areas to be able to provide us with assistance and support. And then within the hospital systems, there's been several meetings that the Joint Task Force and the healthcare systems have had to look at the staffing needs and what are all the potential options locally. And that includes looking at people who are licensed to practice that may need some additional training to be able to provide support. So they may not be able to provide support in the ICU, but they may be able to provide support elsewhere so that a more either trained or experienced person can go to the ICU. We will be meeting with the local institutions that graduate nurses, physicians, pharmacists, and so on later this week to see how we can partner with those institutions to bring faculty potentially to practice or some of the students to be able to assist. Obviously, there's also the option of looking at temporary agencies. That's less of an option just because they're being depleted nationwide. And then the last is also the Medical Reserve Corps, which are volunteers who are licensed. Many of them are retired or semi-retired that will continue to do some work on a volunteer basis. So we're looking at all of those to see what are the best options and how do we bring every solution that we possibly have to bear. And then again, the healthcare systems are already doing quite a bit to be able to retrain staff, move staff over, be able to use, within the CDC, there's an allowance for essential workers to work while quarantined during a staff shortage. So they've put policies in place to assure that people can work if they need to during a staff shortage, but that monitoring occurs of those individuals. And then obviously they have reduced, when needed, their elective procedures. So it's all of those things together. You have a follow-up?
Yeah, now that you mentioned it about needing extra staff for vaccine distribution, can you quantify that for me?
So at the current time, for phase 1, so with vaccine, there are several groups that will be vaccinated, and vaccine will be distributed directly to healthcare systems so that they can vaccinate their own personnel. The health department will get vaccine that is for the initial group, so group 1A, which includes first responders, paramedics, and some others. We need to be able to administer that in the field, so we anticipate at the current time having 2 sites available for providing vaccine. Ideally, that'll be drive-through sites, and that we may need anywhere from 25 to 35 people per shift in any of those locations. So you're talking about 50 to 60 people, and obviously people can't do that every day, and so you want to at least try to double that so that you have backup personnel if need be. We anticipate having a close to finished plan by the end of this week. And I know we're running on time, so I wanted to add a few comments to Dr. Randolph's comments relative to the event that happened this weekend. We really focus on assisting businesses in their day-to-day operations. So the event that has been in the media, we really want to view that as this was different than their day-to-day operations. It was a special event that ideally would have been submitted to the health department electronically for review and technical assistance, and it was not. We have worked with that owner on their day-to-day operations to make sure that that was safe, but this is a special event in the course of that, and that's important. The other thing is, again, we always strive to have the health directive be as clear as it can be, but what we find with each health directive, there will be workarounds that various individuals and businesses will put in place because things were not explicitly spelled out in the health directive. So it's really important to recognize that an enclosed tent, even though it's on a parking lot or it's outside the normal structure of a building, is still an enclosed space and is then therefore treated as an enclosed space. And it's important for everyone to think about that because many restaurants do have outside eating, but once you start closing it in and putting up plastic and zipping things up, there really increases the risk of transmission. So outside really means outside, with the air being able to circulate through the space without any barriers whatsoever.
All right, we are out of time. Thanks, everyone. We will see you back here on Thursday.